Greetings, future nurses. This is Nurse Ed Scholar here. Today we're going to dive into the nose, mouth, and throat assessment. So join me into the nuances of, subjective and objective data collection, to make sure that you are well equipped into providing uh, competent and safe nursing care. So, all righty. So we're going to begin with the assessment of the nose. Um, when we're talking with our patients, we're going to ask questions like, is there any nasal discharge, nosebleeds, facial or sinus pain? Have they recently had a cold or flu? Any altered sense of smell, allergies, medications that they could be taking, past trauma, or even any nasal surgeries. Okay. And that information is going to help lay the groundwork of your assessment. So when you move on to the objective data, you're going to inspect the external nose. You're going to look for alignment and proportion. Is it the right size for this? You're going to test for patency of the nostrils, where you may like have them close one nostril, take a deep breath, and then move to the other nostril. You're going to assess for any kind of redness, swelling, bleeding, or recent bleeding, maybe some blood still in the nares, discharge, foreign bodies. And you're going to look at the nasal septum to see if there are any deviations. Okay. And and all of this kind of ensures, an adequate, appropriate examination. And then we're going to look at the sinuses. Because, they play a crucial role, and you're going to test the frontal and maxillary sinuses for any pressure. Uh, Feeling firm pressure, but no pain indicates normalcy. It's normal. They'll feel the pressure of you pushing down, but if they have pain that's produced by that pressure, well, then that is abnormal. Okay. Um, and so we just want to make sure that we collect everything that we can in our assessment of the nose. Now, when we move to the mouth, um, and throat, we're going to ask subjective questions like, are there any sores in the mouth? Bleeding? Have you had any bleeding? Altered taste? Toothaches? Are they wearing any dentures? What's their oral habits? Do they like chew tobacco? Do they brush regularly? Do they floss? Um, are they doing any at-risk behaviors like smoking, um, alcohol consumption, um, drug use? Any recent mouth infections, maybe a dental abscess, a tooth abscess, any trauma or recent surgery. Okay. Then when we're moving to objective data, we are going to inspect their lips, their teeth, their gums, the tongue, the buccal mucosa, the hard and soft palate of the mouth, the uvula. Okay. We're looking for color and moisture, lesions, swelling, discolorations, any nodules, any exudate, like on those tonsils. Okay. We want to look at all of that to determine the patient's oral health. All right. Oh, and prior to client teaching, you want to make sure there are two things that you're going to make sure that you're assessing for. You are going to assess for cranial nerve 10, which is the vagus nerve. And how you do that is by asking the patient to say, ah, okay. And that's, you're just going to watch the soft palate and the uvula rise midline. And then another test would be cranial nerve 12, which is the hypoglossal nerve. And you're going to ask the patient to stick out their tongue. It should be midline. And then you'll test the next cranial nerve will be a gag reflex. Maybe like taking that tongue depressor or and kind of putting it in the back of the throat. And if they gag, that's testing cranial nerve 9. Okay. And all of those things are just making sure that you're doing a thorough evaluation. Okay, now leading to client teaching. I jumped ahead on my slides. Um, you know, the main thing that we do as nurses, we educate our patients. Okay, so we have to know a lot of knowledge. So we're going to emphasize oral hygiene, educate our patients about regular dental examinations, um, healthy habits, flossing, using fluoride toothpaste. We're going to educate them on avoiding those at-risk behaviors like smoking, like alcohol consumption, like drug use. Okay. And then to report to their primary care provider any abnormalities, like any nodules, do they see any nodules or lesions or signs and symptoms of infection? Um, and definitely pain. You want to make sure that if they're having any discomfort, for them not to grin and bear it, to educate them to follow up with their primary care provider. All right, so that kind of wraps it up. I mean, quick, brief overviews give you a lot of that information that you need for your testing purposes. I want to thank you for watching Nurse Ed Scholar. And congratulations, I'm gonna say it all the time on your future nurses. You're mastering, every day, each assessment, and as we continue through all of the other concepts, you're gonna master this. You're gonna be great at this, okay? Just, keep going, keep practicing, keep honing in on your skills. And with that, best of luck on your journey. And until next time, have a great day.